In this simulation, the patient, played by Brandon, reports to an outpatient neurorehab clinic with his brother, played by Bennett. He is being evaluated by the neurorehabilitation team, played by Shelby as the occupational therapist and Dominica as the physical therapist. After a quick introduction, the physical therapist will jump into the first assessment, which is the orientation neuro exam. In answering the therapist's questions, you will see that the patient presents with Broca's aphasia.
Hi, my name is Dominica. I'm a student physical therapist at USA.
My name is Shelby Pierce. I'm a student occupational therapist also at USA.
How are you guys doing today? Good. And what's your relation to the patient?
I'm his brother.
Your brother, okay. Just one thing, okay. And this is the patient, yes? Okay. Could you tell me your name and date of birth and where you are?
Brandon. Poundstone. August 20th, 1995.
Okay, good. And can you tell me where you are?
Hospital.
Okay, good.
Next, the occupational therapist will begin testing cranial nerve 5 and 7 for motor and sensory function, where you will observe deficits in the right side of the patient's face.
So what we'd like to do with you today is just do a quick little screening, see what you're able to do, so we can come up with a treatment plan and get you going with physical therapy and occupational therapy. Is that okay? You just
Yes.
nod, okay? Okay?
You guys can ask me questions too. I know speaking is pretty difficult for me.
Okay.
Okay. So to start off, I'm just gonna check some sensation in your face and your arms, and then some of the tests involve using a pinprick. Is that okay with you? You nod your head if it's yes. Okay. And I'll first start off with kind of some facial expressions. So just simple enough, just okay. Just can you smile, showing your teeth. Okay. And then puff out your cheeks like this. Okay. And then I want you to close your eyes for me and punch them tight. And then you don't want to look like a knuckle. Okay. And then for the sensation test, I'm gonna have you close your eyes, and I just want you to tell me what side you feel it on, okay? And if you don't feel it, you're fine. And you just okay. And now again, I'm gonna do the pinprick. Feel that? Let me know if you feel it, okay? All right, you can open your eyes for a second.
Now the occupational therapist will use the pinprick test for sensation in the upper extremities. You will notice that the patient shows no indication of touch sensation to his right arm.
Okay, now I'm going to do the exact same thing on your arms, okay? Now when you close your eyes again, just let me know. And then can you tell me if this feels the same as this?
Yes.
You feel that?
Yes. That doesn't hurt, right?
You find if that feels the same as that? And does this feel the same as this? Okay, perfect. You can open your eyes. I'm all done with that part.
Now the physical therapist will test for abnormal synergy patterns. You will see normal movement in the patient's lower extremities and left arm, yet he struggles to lift his right arm.
Okay, so what I'd like to do with you today is just check a little bit of range of motion in your legs and your arms, and a little bit of strength. Is that okay? Okay, so actually we're going to start with some range of motion, so I'll demonstrate right next to you. So what I'd like you to do first with your left side is just can you raise it up and bring it back down? Okay, are you able to do the same thing on the other side? Okay, and now with your left arm, I'd like you just go straight ahead as far up as you can and back down. And can you do the same thing with your right side? Oh. And relax. Okay.
Next, the physical therapist will perform gross motor testing on the patient's lower and upper extremities. The patient has normal strength in his lower extremities and left arm and weakness in his right arm.
Now what we'd like to do is a little bit of strength testing on some of the extremities, okay? Alright. So what I'd like to do, alright, hold on when you're moving. Hold on when you're moving. Okay. Hold on when you're moving. Good. Hold on when you're moving. Okay. You know, wash my hands. The same thing, sweet. Alright. Hold on when you're moving. Good. 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 And relax. Same thing with that. Okay. Wash your hands. Now we're gonna start with the left side. Alright. So hold on when you're moving. Good. Hold on when you're moving. Good. Can you raise your shoulder up for me? Hold on when you're moving. Good. Hold on when you're moving. Good. And relax. And with this side, are you able just to kind of bring it up? Can I one more time for me? Do you have pain with that? Okay. Okay, so I'm done with the motor control test.
The next clip shows a brief caregiver interview to learn more about the patient's home life and symptoms.
So I just wanted to ask a couple questions in regard to Brandon. I was just wondering what his living situation was and, just how he's doing overall, since he's having difficulty speaking.
Sure. So he suffered from the stroke about a month ago,
Okay.
and since then, just because we thought it'd be easier, he's now moved into our house,
Okay.
single story,
Okay.
and it seems like he understands what we're saying to him. It's just been kind of difficult for him to get the words out.
Okay.
Other than that, he's been walking okay. It just seems like that right arm just doesn't really want to move for him. So other than that, he's been doing all right.
Now that you have viewed the simulation, let's review the patient's stroke symptoms. Number 1, the patient has Broca's aphasia, which affects his ability to produce speech. Number 2, the patient's facial muscles are weak on his right side. Number 3, the patient shows sensory loss to the right side of his face and his upper extremity. Number 4, the patient showed an abnormal synergy pattern when lifting his right arm. And number 5, the patient showed right-sided weakness in his upper extremity. Given these symptoms, can you guess the location in the patient's brain where the stroke occurred? Good luck!